Introduction to Hematology, the Physiology of Blood and Blood Types. Although carrying oxygen and nutrients to cells and removing waste from cells is the main function of blood, it is important to realize that blood also serves in defense, distribution of heat, and maintenance of homeostasis. Transportation. Nutrients from foods you eat are absorbed in the digestive tract. Most of these travel in the bloodstream directly to the liver, where they are processed and released back into the bloodstream for delivery to body cells. Oxygen from the air you breathe diffuses into the blood, which moves from the lungs to the heart, which then pumps it out to the rest of the body. Endocrine glands scattered throughout the body release their products called hormones into the bloodstream, which carries them to distant target cells. Blood also picks up cellular waste and byproducts and transports them to various organs for removal. For instance, blood moves carbon dioxide to the lungs for exhalation from the body, and various waste products are transported to the kidneys and liver for excretion from the body in the form of urine or bile. Defense. Leukocytes protect the organism from disease-causing bacteria, cells with mutated DNA that could multiply to become cancerous, or body cells infected with viruses. When damage to the vessel results in bleeding, blood platelets and certain proteins dissolved in the plasma interact to block the ruptured areas of the blood vessels involved. This protects the body from further blood loss. Homeostasis. If you are exercising on a warm day, your rising core body temperature would trigger several homeostatic mechanisms, including increased transport of blood from your core to your body periphery, which is typically cooler. As blood passes through the vessels of the skin, heat would be dissipated to the environment, and the blood returning to your body core would be cooler. In contrast, on a cold day, blood is diverted away from the skin to maintain a warmer body core. In extreme cases, this may result in frostbite. Blood helps to regulate the water content of body cells. Blood also helps to maintain the chemical balance of the body. Proteins and other compounds in blood act as buffers, which thereby help to regulate the pH of body tissues. The pH of blood ranges from 7.35 to 7.45. Blood types. In order to understand blood types, it is important to understand several terms that relate to the body's immune functions. Antigens are substances that the body does not recognize as belonging to itself or self, and that therefore trigger a defensive response from the leukocytes of the immune system. Many people have antigens on the surfaces of their red blood cells. More than 50 antigens have been identified on erythrocyte membranes, but the most significant in terms of their potential harm to patients are classified in two groups, the ABO blood group and the RH blood group. Antibodies are proteins which are produced by plasma cells in response to a non-self antigen being present in the body. Antibodies attach to antigens on the plasma membranes of the erythrocytes in a blood transfusion and cause them to adhere to one another. Agglutination refers to the resulting clumps of red blood cells that are formed in such an antigen-antibody reaction. These clumps can block small blood vessels, thereby cutting off the supply of oxygen and nutrients to the tissues. Hemolysis, or the breakdown of the erythrocyte's cell membrane, takes place as the clumps of red cells start to degrade. The resulting release of the cell's contents, mainly hemoglobin, into the bloodstream can cause kidney failure. The ABO blood group. ABO blood types are genetically determined. Each type is determined by the presence or absence of certain antigens on the individual's red blood cell membrane, as well as the presence or absence of certain antibodies. Normally, the body must be exposed to a foreign antigen before an antibody can be produced. This is not the type or case for the ABO blood group, in which some blood types come preloaded with their own set of antibodies against another type. The table below. So blood type A is people whose erythrocytes have A antigens on their erythrocyte or red blood cell membrane surface. People who have type A blood without any prior exposure to incompatible blood have preformed anti-B antibodies circulating in their blood. These antibodies will cause serious immune reaction if they encounter blood that has B antigens. Blood type B, people whose red blood cells have B antigens. People with type B blood has preformed anti-A antibodies. Blood type AB. People can have both A and B antigens on their erythrocytes, in which case they are both blood type AB. Individuals have type AB blood do not have preformed antibodies to either A or B antigens. Blood type O. People with either A or B antigens are designated blood type O. People with type O blood have both anti-A and anti-B antibodies circulating in their blood plasma. Type O is people with neither A or B antigens. They are designated type O. The RH blood group. The RH blood group is classified according to the presence or absence of a secondary erythrocyte antigen identified as RH. Those who have the RhD antigen present on their red blood cells are described as Rh positive, and those who lack it are Rh negative. Note that the Rh group is distinct from the ABO group, so any individual, no matter their ABO blood type, may have or lack this Rh antigen. When identifying a patient's blood type, the Rh group is designated by adding the word positive or negative to the ABO type. For example, A positive means ABO group A blood with the Rh antigen present, and AB negative means ABO group AB blood without the Rh antigen. The hemolytic disease of the newborn, or HDN. Antibodies to the Rh antigen are produced only in Rh individuals after exposure to the antigen. This process, called sensitization, occurs following a transfusion with Rh negative incompatible blood, or more commonly with the birth of an Rh positive to an Rh negative mother. In a first pregnancy, problems are rare since the baby's Rh positive cells rarely cross the placenta. However, during or immediately after birth, the Rh negative mother can be exposed to the baby's Rh positive cells. This occurs in about 13% of such pregnancies. After exposure, the mother's immune system begins to generate anti-Rh antibodies. In a second pregnancy, if a mother should conceive a Rh positive baby, the Rh antibodies she has produced can cross the placenta into the fetal bloodstream and destroy the fetal red blood cells. This condition is known as hemolytic disease of the newborn, HDN, or erythroblastosis fetalis. This may cause anemia in mild cases, but the agglutination and hemolysis can be so severe that without treatment, the fetus may die in the womb or shortly after birth. A drug known as RhoGAM, short for the Rh immune globulin, can temporarily prevent the development of Rh antibodies in the Rh negative mother, thereby averting this potentially serious disease for the fetus. RhoGAM antibodies destroy any fetal Rh positive erythrocytes that may cross the placental barrier. RhoGAM is normally administered to Rh negative mothers during weeks 26 through the 28th of pregnancy and within 72 hours following birth.